went to medical school and I trained in London and did my specialist registrar training in orthopaedics in London as well, and then went out on fellowship to Australia to learn about complex acetabular joint replacement surgery, and then came back to the UK and worked up at the bone tumour unit in Stanmore, learning about endoprosthetics and more complex femoral reconstruction. And I was appointed at Frimley Park Hospital 5 years ago now, where I've developed a young adult hip surgery practice, and I now have my own fellow who I'm training to do similar sort of surgery. So I see young adults with hip and groin pain who may require joint preserving hip surgery, which may be arthroscopic or keyhole, and I see young adults and older patients with similar symptoms due to established hip arthritis that require joint replacing hip surgery.
I used to go to a gym quite a lot, and I had trouble getting onto the equipment because my legs weren't moving the way they should. At first I thought it was because I was doing too much exercise, and then I realised it was a bit of a wear problem. And so I went to see the doctor. He introduced me to the surgeon. They'd done some x-rays and decided that both hips were quite bad. And that was 5 years ago. So in 2013 they changed my left hip, and then 3 months ago they changed my right hip.
Mr Lennon's first hip replacement was at Frimley Park Hospital as an NHS referral, and his second one was at Clare Park Hospital, but also as an NHS referral as well. So at Clare Park we see patients who are privately funded, self-paying, insured, and patients who ask to come and see us as a choose and book patient through the NHS as well.
As well as having the bad hip, there was a cyst on the hip as well, and it was causing so much pain, so they said, yeah, let's get you as quick as we can. Within a week or so I got a phone call saying, would you be happy to go to Clare Park, which is a Spire hospital, but we do it on a choose and book scenario, so you don't have to pay anything, it goes through the NHS. And I was naturally delighted, and I took the option.
I try to run an enhanced recovery program here, so patients walk the same day as their operation, and they go home usually on day 2 or possibly day 3 after their operation. And I think this helps to reduce the complication rate from surgery, and that they get a better functional outcome after the operation and an earlier return to work.
My first impression was the relaxed atmosphere. You just got personalised treatment right from the start, and you felt relaxed, at ease. It was amazing, even after the op. Mr Sturridge, he had time to come and see me, see how I felt, wiggle my toes, make sure I was comfortable, I had everything I needed, and it was just a feeling of he really cared. It was fabulous.